Hi friends, we have known and we have seen that B-cell ALL is a problem. Though it's a pediatric problem, B-cell ALL, remarkable results have been achieved in pediatric age group. 80%, 90%. Standard risk, intermediate risk, fantastic. The chemotherapies has been the backbone and they have been helping the people in past 50 years in a big and huge way. But what about the adult patient suffering from B-cell ALL? B-cell is B acute lymphoblastic leukemia. So whosoever is listening and watching this video, please ask the diagnosis with a B-cell ALL. B-cell ALL in adult with our chemotherapy which we give you either UKLL, BFM, pediatric inspired, GMAL, the response rates in the developing country is not more than 50-55% patients. It means that out of 100 patients, only 50 or 55% people will achieve a cure. What happens to the next? They go for a bone marrow transplant, and after relapsing, bone marrow transplant is again a good option but not the perfect option. So another 30-40% people will be salvaged by bone marrow transplant. But rest, what happens to the B-cell ALL people who relapses even after bone marrow transplant or could not get a bone marrow transplant or cannot afford a bone marrow transplant? Then the CAR T cell comes in, and that's where the government of India has approved CAR T cell for B-cell ALL as a bridge to bone marrow transplant. B-cell ALL in which people have relapsed after chemotherapy and the transplant is not an option, and in a head-to-head comparison to the transplants, still the data is coming out. In B-cell ALL, it is a bridge to the transplants. It means it helps you to eradicate MRD and potentially curing few of the patient subset if you are able to track by clone track or clone-seq, which goes up to 10⁻⁻⁶. So it means if you are able to achieve a deep responses with CAR T cell, persistent responses with CAR T cell, probably that is the time we can expect to achieve a cure. And B-cell ALL, as we know, can present with fever, bony pains, weight loss, night sweats, lymph nodes enlargement, infections. It can present you with anything. So we need to be aware that in ALL, it is being a huge boom for the people suffering from a relapsed refractory ALL at this present moment of time. And that's where we have been offering CAR T cell for B-cell ALL patients. Thank you.